thousands of infants and mothers die annually due to complications during pregnancy and birth. These deaths could be prevented if proper medical care and attention are made available to mothers in an effort to reduce maternal death. Midwifery plays an important role to introduce women to healthcare system and ensure that babies and their mothers receive a continuum of skilled care during pregnancy and childbirth. The Jubbaland State of Somalia's Health Ministry has initiated a midwifery training institute in 2015 in a bid to train and engage students who will be highly specializing in midwifery and help to serve mothers and infants in both local hospitals and remote villages of Jubbaland State of Somalia. The construction of the midwifery school in Kismayu came at a time when the institute was formerly housed in a rented premises, coupled with a myriad of challenges and tribulations. The project was funded by the German Federal Ministry for Economic Cooperation and Development, partnering with the Jubbaland Ministry of Health, and implemented by the Corp and GIZ. The German federal government is known to be quality-oriented and has stood the test of time as one of the world's best and widely recognized for this unbeatable quality work output. A lot of German-driven initiatives has been widely felt across many regions in Somalia since the era of President Mohamed Siad Barre. Infrastructure being a key component in Corp's programs and work, it has successfully implemented the infrastructure project for the GIZ and thus producing a top-notch construction project which is unmatched in the construction industry. The center houses a boarding wing, an administration and a teaching section, a library and a computer room, among other amenities in its vast premises. The facility, which is now being run by the Jubbaland Ministry of Health, is equipping the midwifery learners to deal with pregnancy, childbirth and the postpartum period. The midwives are also trained to examine and monitor women, undertake antenatal care, carrying out screen tests and provide information, emotional support and reassurance to women and their partners. Speaking during the official handing over of the infrastructure project from Corp and GIZ to the Jubbaland Health Ministry, the Jubbaland Health Minister Dr. Mursal Mohammed lauded the efforts of the German government for the generous gesture, adding that it took a leading role in supporting and enhancing support and helpful services to the people of Somalia. Dr. Mursal, who also inspected the midwifery center, expressed the need for a sustainable and extensive support to help in the health sector, since the Horn of Africa nation suffers largely on maternal and child mortality cases.
I'm Dr. Mursal Mohammed Khalif, the Minister of Health for Jubbaland State of Somalia. This is an event where the handing over of the Midwifery Institute for Jubbaland is being made, and we're very grateful to the generous support of the German government through GIZ and BMZ. We are looking forward to increased collaboration in the health and human services sector with the German government. Historically, the German government have been close friends and supporters of Somali people, and institution building in Somalia could not have been possible to the extent it is at this point without the German government. From human services like education and healthcare to resettlement of returning refugees from camps in Kenya, for instance, are all supported through generous donations from the German government. We want to let the German people and the German government know that there is a lot more to be done in the delivery of human and healthcare services in Somalia in general and in Jubbaland specifically.
GIZ program coordinator Sirad Mohammed said the Midwifery Institute in its early stages of inception struggled for lack of good infrastructure and at a time faced an outstanding rental arrears which proved difficult for the institution, thus bringing this noble project funded by the German federal government. Mr. Sirat thanked Corp for the good construction work of the facility and called on the administration and the health ministry to be the custodians of the equipment and the facility.
My name is Sirat Mohammed Ali. I work for GIZ as a program coordinator, leading projects in Kismayu. We were doing an assessment for the Somali reintegration program, an appraisal mission which was changing the components of the project, and when we met the Ministry of Health, they informed us that there was a gap in midwifery school. There was support they were getting from other partners to train students in midwifery classes, but they did not have a center where they were supposed to train. They were living in a rented house, and they were unable to sustain and pay the rent. So they made a proposal to us. We accepted the request, and we said we are going to develop this center. This land was a contribution from the government. It was a formerly government-owned land, and it was earmarked now, handed over to the Ministry of Health to be used for this. I request the management of this school. I requested the Ministry of Health that they take great care of the infrastructure, because this infrastructure is nice, it looks good, but it still needs maintenance. I know the quality here is good. We did a lot of work with Mercy Corps before. They constructed the public health unit in Midnimo, which is one of the best facilities in Kismayu.
Mercy Corp Deputy Program Manager Abdul Nasir Aden underscored the critical role the institute will play in giving the learners the opportunity to help the community by instilling knowledge and skills to better the lives of the vulnerable mothers during delivery.
My name is Abdul Nasir Aden. I'm a Deputy Program Manager for Mercy Corp. Mercy Corp was given the opportunity to rehabilitate and construct one of the biggest midwifery school in Kismayu. And Mercy Corp did the job as it was required under infrastructure manager of Mercy Corp. Mercy Corp is trying to at least engage the vulnerable community through cash work model, whereby now, and we were also trying to improve their livelihood through the provision of daily services. And also one of the achievements will be, or one actually has been, that Mercy Corp has supported this infrastructure.
Mr. Beko Mohammed, who is the Mercy Corps infrastructure manager and his work cut out for in all the engineering works in Somalia, applauded the cash for work modality, which produces the best quality output and gives back to the community by directly benefiting the laborers. This modality was a joint selection process by the Mercy Corp and the GIZ and has tremendously led to the great success of projects.
My name is Engineer Deko Mohammed Hurre. I'm the infrastructure manager for Mercy Corps. I'm in charge of all the infrastructure work in Somalia. As Mercy Corp as an organization, infrastructure is a very important component in our work, and we always strive to do very high quality work. We have worked with GIZ in 2 projects now. The first one was the construction of the primary health unit in the Midnimo village, which is located in Kismayu. Now our second project is this one, which is now the construction of the midwifery school. As you can see from the construction work we do is always high quality work. We always strive to make sure that we deliver a project according to the client specifications. We have also, in the process, we have done this work through cash for work. We have employed local artisans, and we have also brought skilled expatriates from Kenya, like the masons, so that they can be able to come and train the local masons here, so that they can transfer that skill. And quite a number of them, have benefited from those skills. And actually now they are employing those skills now to work, to fend for themselves, to fend for their families in Kismayu now. And some of them even have gone to Mogadishu.
I'm Nasser Abdullah Hassan. I never had a job for a while, and I live in Kismayu. And this work is really helping me and supporting my family. I sacrificed and told to work hard to reach where I am today, unlike before. I want to be a good mason. I want to learn a great deal of masonry work, courtesy of Mercy Corp. My name is Ali Nur. I live in Kismayu. I'm really grateful that I came here first, willing and ready to learn this masonry work. And I'm really amazed to be one of the masons who benefited from this initiative. I learned a lot and thankful for the good work by Mercy Corp. I'm called Abdullah Mursal. I've been here for a while now, trying to keep myself with a good masonry work. And today, I'm really happy. And a proud mason who learned a lot. And I'm extending my gratitude to Moscow International for such an opportunity to shape me and make me a great masonry worker. I'm really helping my family.
Fauzi Ahmed, who is one of the trainees of the Midwifery Institute, expressed her gratitude to the German government, saying that this impressive gesture will tremendously come to the aid of vulnerable mothers by producing a highly skilled and trained midwives.
My name is Fauzi Ahmed Ali. The program is a Midwifery Training Institute, so where we learn resources to help us with the midwifery program. This midwifery program will reduce mortality and morbidity rate too, not only just mortality, because you have a lot of skilled attendants that went through the theory process and also went through the practical process through this. We're also trying to eliminate a lot of TBAs that have been inherited the job through other their parents or something like that. So yeah, it should reduce the mortality rate.
Another graduate from the Kismayu Midwifery Training Institute is Leila Ahmed, who now provides an array of healthcare services for women living in remote and far-flung villages or in Jubbaland state of Somalia, and assisting in preventing a lot of birth complications during pregnancy.
My name is Leila Ahmed Abshir. I'm one of the students who learned skills here in midwifery. I'm now attached to a dispensary located in the Afmadal region, in Jubbaland region. I'm trying to help mothers give birth and try to avoid them experiencing some complications. I'm really grateful that I learned these skills, and I'm trying to give it back to the society by trying to help them. I'm really grateful.
Another project also undertaken by Mercy Corp in partnership with GIZ is the construction of a primary health unit in Benima village in Kismayu, which serves the refugee returnees from the Dadaab in Kenya and the less fortunate host community in Kismayu. The hospital is now fully functioning with both outpatient and inpatient units, both for men and women, among others. The hospital is now run by Save the Children and is arguably the second best after Kismayu General Hospital in service delivery.
My name is Yusuf Abdul Qadir Abdurrahman. This room is at OTB room. We admitted as a patient with severe malnutrition, acute malnutrition. We admitted a patient with severe malnutrition, with severe acute malnutrition. And there's a criteria we admitted to patients from 6 months to 59 month patients. We admitted so, and under 5 years also. School is under 5 years. This field is a very suitable place. Its location is a very beautiful place because of this Minima village is a returnee